Hi everyone, thank you so much for tuning in to Mid-Level U e-courses. Today I'm here with Alex Fisher. She's an associate at Thompson Burton here in Nashville, and she works a lot with nurse practitioners and physician assistants on any legal issues that arise in their practice. And so today I want to talk about sex, drugs, and alcohol and what you need to know in regards to those things in your profession. So Alex, let's talk first about dating. Is it ever okay to date or have a romantic relationship with a patient? What do we need to know about that? It seems like there could be a lot of potential room for things going wrong.
Yes, you are correct. There is a lot of potential room for things to go wrong. The bottom line is you can't have a romantic relationship with someone who is a current patient.
Okay.
So then the question is, well, what do you need to do if you want to have a relationship with someone who is a current patient?
Right.
Essentially, they need to be transferred to another provider.
Okay.
And it's recommended that a period of time passes, that it's not the next day that you start dating them, that you allow a little time for someone else to begin treating them before you start dating or commence a relationship with the person.
Okay. And how far do you need to go with formalizing this sort of break in your professional relationship? Do you need to have, some sort of an attorney draft a document, or do you need to just transfer their medical record? Do you need to have any sort of formal process in sort of firing a patient or abandoning that relationship?
That's a great question. I honestly don't think it has to be that formal.
Okay.
I think they could even be transferred to a provider in the same clinic. They don't have to go 100 miles away. But it needs to be very clear that, for a period of time, maybe their next couple months visits are to another provider. When you look in your system at the providers and whose patient is whose, that it's clear that that individual is no longer your patient.
Okay, great. Now, are there ever any cases when it is not okay to date a patient, no matter what your feelings are, no matter if they're transferred to another provider?
I think there are definitely some instances in which it's never appropriate. Typically, if you're working in any sort of mental health setting,
Okay.
Where a patient is particularly vulnerable, we look at mental health or any sort of psychiatric environment where you're kind of gaining access to someone's mind and thoughts, that once you're kind of acting as their healthcare provider in that sense, the relationship will always be imbalanced. And there's always a sense of you may be taking advantage of them because you know all of these intimate, vulnerable things about that person.
Okay, that's a good point. Then what about drug and alcohol use? In a lot of cases, using alcohol is not illegal. In a lot of states now, using marijuana is not illegal. Is it illegal to, use these in your life as a nurse practitioner? Sort of, where do you draw the line there?
That's a really good question. I think, there's a difference between what is professionally not acceptable and what your employer may not find acceptable.
Okay.
So you can obviously be fired for something that wouldn't lead to professional discipline. So 1, be aware of what your employer's expectations are. And 2, what I've seen a lot for nurse practitioners and physician assistants, when you're in healthcare, you work weird hours.
Right,
Usually,
of
you're
course.
not working a typical Monday through Friday, 9 to 5. So just be aware that, while some people can go have a couple drinks on the weekend, your weekend, you might be going into work 4 hours later after you leave, say, a social event or going to a wedding or something else. So just be aware of the timing of when you may be engaging in having a couple drinks with your friends and when you have to go into the hospital or your clinic.
Okay, that's a really good point. I know I work a lot of night shifts, and sometimes you'll go out to dinner with friends before work, and you have to say, no, I can't have a drink, and so it's really important to, I think, be aware of that and really err on the side of caution here. We work with patients; we could be putting them in harm's way, and so I think it's really important to be very cognizant of that. If you do slip up and get in trouble for maybe drug or alcohol use that's done in an unprofessional manner, what sort of disciplinary action does the Board of Nursing or the Board of Medicine take against you?
It can really range from a letter of concern all the way to asking you to surrender your license.
Okay.
And that really depends on, did you come to work, you didn't look impaired at all, but you had a random drug test and it came up positive, versus did you come to work, was a patient hurt? Did your coworkers complain that your speech was slurred and you didn't seem, together, all there at the same time? The Board of Nursing really looks at, of course, 1, if anyone was harmed, and 2, the likelihood that someone could have been harmed.
Okay, that's good to know. What about prescription medications? There are a lot of prescription medications that could potentially impair your judgment. But if you have a prescription, is it legal to take those at work? What are the boundaries related to that?
So that's something I've seen a lot. And I think the boards of nursing kind of wrestle with it too,
Mm-hmm.
because you have a legal
Yeah.
prescription, but you are in a role, unlike me as an attorney where I'm sitting in front of a computer all day, where you have your hands on patients, where it is life or death situations. So I think just being cognizant of how your prescriptions affect you. Maybe don't take a medication for the first time ever right before you go on a 12-hour shift. Be aware of how your medication affects you. If you're supposed to take something daily, for example, like Adderall, make sure that you're actually taking that daily and consistently so that it can do the job it's intended for.
Got it. So consistency is important, and making sure you know how the medication will affect you. So, well, thank you so much for being here today. If you run into any trouble or have any questions related to professional boundaries when it comes to relationships with patients, drug, alcohol, and prescription medication use, feel free to contact Alex. We'll post her information on the blog. She's happy to help.
Thank you, Erin.
Thank you.